You're welcome. Well, I'll take you through the details of those stories now. We'll take a look at the case count so far. More than 7,000 cases, in fact, more than 300 difference in what we knew yesterday before we went to sleep. Head of our health desk, Fred Smith, is here in the studio to help us with the breakdown. Fred, over 300 new cases.
Yes, 313 new cases were recorded over the last 24 hours. It brings our total case count to 7,616. And of all of this, we still have the deaths standing at 34. The recoveries, as we speak, currently 2,421 people have so far recovered. And Gifty, the current active cases as a result of this is 5,161. It means that 5,161 people are still under treatment for COVID-19 in Ghana.
Okay. In that case, do we have an idea what the regional breakdown looks like at the moment? Well,
indeed, the Greater Accra region, we know, has always been leading in this because of the special role it plays in our nation's geopolitics. So, as we speak, we have 5,331 persons who have contracted COVID-19 in the Greater Accra region. The Ashanti region follows with 1,160 cases. Then it's followed by the Western region with 395, Central 376, then Eastern region with 117 cases. Then we have the Western North region with 63, Volta region 59, Northern region with 36, Oti region 26, the Upper East region 26 as well, the Upper West region with 22, Northeast region with 2 cases, and then we have Savannah, Bono region, and Bono East, giving you 1 case each for all those regions. And the number of regions I've mentioned to you now, Gifty, amounts to 15, and it means that we still have 1 region without a case. As we speak, then that will be the Ahafo region.
I like the way you put it. It means that we still have 1 region that has no case. This was the case about 2 or 3 weeks ago, but it took just a few hours for that to change.
Indeed, as of yesterday, we still have 2 regions without cases, and that has also gone into it. And so we now have just 1 region, and the prayer is that we don't record any case in the Ahafo region.
Oh, people have said that it's just a matter of when and not if. And so for us, it's a matter of deciding what lessons we take from those few who didn't, or the regions which didn't, which eventually recorded, and how we can stop that from spreading. Fred, what do we know about the global outlook?
Well, in terms of the global situation, we have 5.8 million cases around the world so far. Those are the persons who have contracted the disease so far. 360,000 people have died, and this information is according to the Johns Hopkins University dashboard. And Brazil is one of the places where the WHO and other health professionals are worried about, because the infections are going up really fast. It is currently the 2nd highest after the United States in terms of number of cases and the number of deaths. And so Brazil is a big worry to the global health systems. But we have Spain, Turkey, France, the UK, and Brazil. They have all announced that they're going to ease or lift the restrictions, at least partially, in all of these countries, and that is a bit of a worry. Restrictions are also easing in Asian countries such as the Philippines and Japan. And as you know, efforts are already underway to ease the restrictions here in Ghana as well. But in South Korea, that's where the interesting thing is, because we've always known South Korea to be the model for managing the COVID-19 situation. We were able to bring the situation under control in a very short time. So they lifted the restriction, and within a matter of days, they are reimposing those restrictions as schools are being shut from today. And
why is that?
It is because of a resurgence in cases after lifting the restrictions. And so it's important to pay attention to certain things before the lockdown or restrictions are lifted, whichever country. And in the case of Ghana, we know some effort is underway to get our mosques, police stations, markets, and other places disinfected before any announcement of the lift of the restrictions.
Well, we'll see how that goes. Fred, thank you for that update. Fred Smith there with the update of our coronavirus cases. He's head of our health desk.